let's talk about some of the key provisions that are in this bill. So some of the key provisions in this bill is eligibility redetermination and stricter asset tests. So when we talk about eligibility redetermination, the way that an individual is considered eligible for Medicaid is going to be changed, okay? So I'm gonna talk a little bit about it in a subsequent slide. This is gonna have a particular impact for states like California, okay? And then stricter asset tests means that income is going to be scrutinized. Assets are gonna be scrutinized in a more detailed manner or intense manner. So this will automatically make many of our patient population ineligible based on assets. Another provision in this bill is work and community engagement requirements. States will have to roll out opportunities for individuals to work and do things within the community in order to maintain their Medicaid eligibility. So before we get into where we're at today, let's do a quick recap of Medicaid 101, the history and the purpose of the Medicaid program. Okay, the Medicaid program was signed into law in 1965 by President Lyndon B. Johnson. And a fun fact, Medicaid was not necessarily the initial vision of President Johnson. Medicaid was the vision of one of President Johnson's predecessors, President Harry S. Truman, who was president of the United States of America from 1945 to 1953. So President Truman had this vision of providing coverage for low-income, elderly, disabled, and pregnant individuals. And although he was not able to execute on that vision during his presidential term, which ended in 1953, President Johnson was able to sign it into law over a decade later. Funding for Medicaid is provided by the federal government and via states. So it falls under what is called an FMAP, Federal Medical Assistance Percentage, where both the federal government and the state contribute to having Medicaid provided throughout their different territories. So the state relies on the federal government for funding, and the state is also responsible for funding its Medicaid programs. And FMAP could be as little as 50%. So for example, states like New York and California, they absorb the minimum amount of funding from the federal government. So they cover 50% of their Medicaid funding. And then you have certain states like Mississippi, which receives the maximum federal match at 83%. So 83% of Mississippi's Medicaid costs comes from the federal government, with West Virginia coming in closely behind, receiving 74% of their funding from the federal government.
Hey, what's up? Just stopping by really quick to make a quick ask. We've been reviewing our data analytics, and we've noticed that we have tons of new individuals checking out our channel, which is geared towards all things healthcare. However, many of our viewers are not subscribed to our channel. Subscribing to our channel allows our content to go into the proper algorithms so that we can spread knowledge related to the healthcare industry to all those who are interested or looking for guidance. So can you do me a favor? If you haven't done so already, can you please like, subscribe, and hit the notification bell? That allows our information to get into the hands of those who truly need it. Thank you so much for helping us out in this way. Let's continue being great together.
If you are a patient and you are watching this live stream, you have to prepare. If you're a patient that's currently receiving Medicaid, you have to prepare for this fallout because it is happening. There's no way around it. So with some of these stricter compliance requirements, we're definitely going to see higher member disenrollment. And that's going to have a direct impact on states like New York, Illinois, that rely on stable member enrollments to keep their Medicaid managed care plans fiscally viable, right? If states try to delay compliance, if they try to, wait it out, then they risk losing their FMAP assistance from the federal government. The federal government will then reserve the right to withhold FMAP funds. And obviously the states are going to have to figure out how they're going to offset those costs in their state budgets. So if a state says, I'm not going to comply, or we're going to take this to court, they risk having their funding frozen by the federal government, and they are going to have to make alternate provisions to be able to fund their Medicaid program in their respective states. And unfortunately, What I foresee, just based on all of the variables, is access to care for many vulnerable populations, because payers are going to have to make tough decisions. Medical providers are going to have to make tough decisions. And unfortunately, our vulnerable populations are ultimately going to be affected by these tough decisions that need to be made as a result of this legislation. So this is the landscape that we're heading into, and these are the uncomfortable discussions that we have to start having as it relates to this new legislation. The big beautiful bill is now the law where Medicaid is concerned, and it's going to have widespread consequences. And it's critical that we begin engaging in uncomfortable but essential conversations about how it's going to affect our medical practices, how it's going to affect our medical institutions, hospitals that serve a large portion of Medicaid patient populations, and patients having these conversations with themselves, because many of them will likely lose coverage. It is estimated that as a result of this legislation in the Big Beautiful Bill, 15 million people could lose Medicaid coverage due to redetermination assets and work requirements triggered by the legislation. And my source for this is the Economic Policy Institute. I didn't wiki this. Okay, I went to the legit folks and vetted out this information. So we're talking about 15 million people across the United States of America. I put out a video earlier this week where I talked about that we already have millions of people. I believe it's about 25 million people under the age of 64 who do not have access to health care. So we're adding another 15 million to that number of individuals in this country that will not have access to medical insurance. That is a staggering number for a developed nation like the United States of America. Okay. The question is no longer if the Medicaid system will change. It's whether we will be ready when it does. The change is here. And my final question is, are you ready? Are you ready, patients? Are you ready with these new requirements? It's happening. You have got to figure out, if you know you likely going to fall off of Medicaid, got to figure out another alternative. I hope you found this information useful. I hope that if there were things that you didn't fully understand about Medicaid previously, that you have a deeper understanding about the Medicaid system now. Please feel free to drop us comments or recommendations for any additional content you would like us to provide information on. My name is Tiffany Robinson, aka Coach Tiff. I am in my daytime job, I am a VP of Revenue Cycle Management, and by night, I am a professional coach and mentor in the RCM space. I love sharing information and empowering people with the knowledge that they need in the healthcare system to make strong strategic decisions. And on that note, I'm going to wrap it up and go enjoy the day with my family. Thank you so much for hanging out with me today. I wish you guys a great day. And best of luck as we navigate these legislative changes. Thank you. God bless. Bye.